Hello, everybody. My name is Anna, and today I will walk you through mood disorders, specifically depressive disorders and bipolar disorders. First of all, what are mood disorders? Mood disorders are a group of mental health conditions that affect an individual's emotional state and overall well being. Mood disorders are characterized by episodes of depressed and manic mood. A depressed mood includes sadness, anhedonia, which is a lack of pleasure to activities that previously brought you pleasure, low energy, feeling of worthlessness, and sleep and appetite disturbance. A manic mood, on the other hand, is characterized by elevated, expansive, irritable mood, inflated self-esteem, decreased sleep, and increased activity. Now, I will go into the different types of mood disorders stated before, such as depressive disorders and bipolar disorders. Depressive disorders include major depression and persistent depressive disorder. To be diagnosed with major depression, you have to have at least one of the symptoms of depressed moods stated previously, for instance, anhedonia and sadness. And the episode of depressed mood has to last for at least 2 weeks. Persistent depressive disorder has milder symptoms compared to major depression, but it lasts for at least 2 years with no symptoms for longer than 2 months. Now I will talk about another mood disorder, bipolar disorder. Bipolar disorder is divided in bipolar 1 and bipolar 2. To be diagnosed with bipolar 1, you have to have at least one manic episode, and a major depressive episode is likely, but it's not required. How does a manic episode look like? During a manic episode, a person may feel unusually happy or high. They may seem extremely optimistic and have an inflated sense of self-esteem, but alternatively, some people may feel irritable, agitated, or easily annoyed. A person may have poor judgment, they also engage in impulsive behavior and make decisions that are very risky, harmful to themselves or other people. On the other hand, to be diagnosed with bipolar 2, you have to have at least one major depressive episode and at least one episode of hypomania, which is a milder version of mania. Now, let's talk about the biological etiology of mood disorders, which refers to the biological factors that contribute to the development of a particular psychological disorder or condition. In both depressive and bipolar disorders, the prefrontal cortex, which is responsible for decision-making, planning, and motivation, is smaller and less active. The hippocampus, which is important for memory formation, is also smaller and less active. The amygdala, which plays an important role for processing emotions, fear, and anxiety, is more active in people with depression and bipolar. And last but not least, the striatum, which is important for motor control, rewarding processing, and habit formation, is more active in bipolar, but less active in depression. Now, we will look into the biochemical etiology. Dopamine, which is responsible for actions, motivation, interest, is lower in depressive symptoms, but higher in mania. Norepinephrine, which is responsible for attention and activation, is low in depression and high in mania. Serotonin, which is responsible for regulating emotions, mood, impulse control, is low in depression and inconsistent in mania. Now we will talk about psychological etiology through the lens of psychodynamic approach. And then we will talk about psychological etiology through a behavioral approach. Psychodynamic approach highlights the importance of understanding the ways in which early life experiences can shape a person's psychological functioning and contribute to the development of mood disorders. We believe that early relationships are very important, and insecure attachments can lead to problems of self-worth, insecurity, and relationship problems. For example, if a child experiences inconsistent or neglectful care, They may develop a sense of insecurity and low self-worth, which can contribute to the development of depression or anxiety later in life. Additionally, psychodynamic theory suggests that unresolved conflicts or trauma from early life experiences can manifest in psychological symptoms in adulthood. On the other hand, the behavioral approach to understanding psychological etiology is about the fact that depression is a learned pattern of experiences, having too many negative experiences and too few positive. According to Seligman's learned helplessness theory, if bad things happen to you without your control, you learn that you cannot control bad things happening to you, and you no longer try to make your life better, basically. Now, what are the treatments for bipolar and depressive disorders? There are a few options, including biological, biochemical, psychological. Biological include electroconvulsive therapy, which gives brief electrical current to the brain of the patient for a few seconds. And the side effect will be short memory loss. That will be the side effect. And this option is good for people who have tried basically everything, but nothing worked for them. Then we have transcranial magnetic stimulation, which increases brain activity in particular areas and can give temporary relief. Now let's talk about biochemical treatments. Biochemical treatments include SSRIs, selective serotonin reuptake inhibitors, which specifically block serotonin reuptake. It works by blocking the brain from taking back too much serotonin too quickly, so there's more serotonin left for the brain to use. Then we have tricyclics. I'm not sure if I pronounced that correctly, which blocks reuptake of neurotransmitters such as norepinephrine, serotonin, and dopamine. Last but not least, we have lithium, which is a mood stabilizer, and it is more for mania than for depression. All right, last but not least, let's talk about psychological treatments. There are several types, including psychodynamic therapy that focus on early relationships, interpersonal therapy, that focuses on current human relationships, behavioral activation therapy to increase positive events and decrease negative events, and teaching social skills on how to handle negative experiences. All right, now I will summarize everything we have talked about today. We discussed mood disorders in specifics, depressive disorders and bipolar disorders. We have talked about biological, biochemical, psychodynamic, and behavior etiology, which are the causes of these disorders. And then we have talked about the various treatments to these disorders. I hope you enjoyed this episode. See you on the next episode. Bye.